Hi, everybody. I'm Kathy Ann, and I have neurogenic thoracic outlet syndrome. And I was diagnosed by my primary care doctor, and I was sent to a vascular surgeon who also diagnosed me. He is one of the top thoracic outlet syndrome vascular surgeons, and I was sent for a second opinion to another vascular surgeon, and she also diagnosed me with neurogenic thoracic outlet syndrome. So apparently, I have neurogenic thoracic outlet syndrome, and I believe it. So I was offered surgery by both doctors and turned them both down. And it's because I never had any problems until I was injured by a chiropractor. And so I'm trying to figure out the mechanics of what's happening with me. So all of us get generally the same surgery where they remove a scalene muscle, take away the first rib, and release the pec muscle. So we're all different. So why do we all get the same surgery? So I'm trying to figure out why I'm having these symptoms. What about me? Where is the compression? So that's why I turned down surgery. I just didn't want someone ripping things out without understanding. So the point of this video is to give alternative therapies before you do surgery or consider it. And so some of these things I tried, some of these things I haven't tried, but they're all worth a try to see if they can help you relieve your symptoms or get rid of your symptoms. So a lot of us have tried pain medicine. So it could be prescription, it could be over the counter like Tylenol and ibuprofen. I guess they technically relieve pain. I don't want to be on medication for the rest of my life, and I've chosen not to take pain medicine. And no one ever gave me a prescription pain medicine. The only time I had pain medicine was when I had my thyroid removal. So I had some already. It started with a T. I can't remember what it was. Toradol. I can't remember. But I've taken Tylenol and ibuprofen. And so don't think I'm weird or anything. But I did not know that you had to take ibuprofen with food because I've never been in pain. And so I didn't really know. And I ended up like tearing the stomach lining. It was so painful. I felt so sick, and I ended up drinking cabbage juice, and I got better. but but there's pain medicine if you need it, and I just don't think that's sustainable. I just don't think that being on pain medicine the rest of your life is the right way to treat this. But there is pain medicine if you need it. We also have muscle relaxers. I have muscle relaxers at home, and they work. I take Flexeril. I rarely ever take it. I only take it if I'm in such severe pain and I've had this migraine for days and I have to break the cycle. Then I'll take one, and it'll break that cycle. It'll bring my pain down, and it'll stay down till the next flare. There's also medications like gabapentin. I think that's a nerve medication. I took that in the beginning, and I had the worst side effect from it. First of all, it didn't help, but when I took it, there was a moment when I was falling asleep that it felt like a lightning bolt hit me. And in that moment, I thought I was dead. But I didn't die. But after that, I started getting hypnic jerks. There's a jerks you get when you're about to fall asleep. You're about to fall asleep and you're jerked awake. And I knew that it was the gabapentin because of the lightning bolt that I had in my brain. And it was the only thing that I did different. And what I think it did is I think it did a reset in my brain, because now I can't take medications that mess with brain chemistry. I can't take any kind of antidepressants. I can't take any kind of pain medicine. The medicine for my thyroid, I was taking that for pain. It causes hypnic jerks. CBD, I can't do that anymore. And that's another option too, is CBD. So remember that these prescription drugs or any drugs can have side effects. And for me, taking that gabapentin, that was horrible. So, and I got nothing out of it. So there's medication. You can also use ice packs, heat packs, magnesium cream, the heat gels, the heat patches, the cooling gels. If those work for you, that's awesome. They don't work for me. They don't really do anything except have me feel the heat or the cooling sensation on top of the pain, but they're there. And one of the more important things you can do is lifestyle modifications. And I have done a lot. So I used to lift weights, and I can no longer lift weights anymore. I can't do any band work. So I got these flabby arms now. Oh well. If I have less pain, then it's worth it. So no lifting weights. Try not to slouch. I can't wear any necklaces around my neck. Nothing around the neck. It feels it's so aggravating. It's like annoying, and it like causes my neck. Just any pressure along here causes me to feel horrible. So, I mean, even a tiny little jewelry chain, it just feels like 100 pounds around your neck. I can't do it. I no longer carry a purse. I wear a fanny pack. Luckily, they're back in style. So, yes, I do wear a fanny pack. This is weird. I can no longer sing in the car. So I would have my 80s on 8 on, and I'd be singing it in the car. And I noticed that after I drove in the car, I would feel horribly sick. Oh, like jaw pain going down my neck. And I realized I was singing in the car and it was aggravating me. I guess, you work your neck muscles when you talk. And even now I try not to like overly talk too much. So no more singing in the car. And the seatbelt. So the seatbelt goes right across here. So sometimes when I drive, I hold my seatbelt over, or I kind of pull it and let it come across here. But then of course it flaps back up. But so lifestyle modifications, figure out what's aggravating the pain and stop it. So those are some of the things that I've changed about myself. It'll be interesting to know if singing in the car aggravates somebody else's thoracic outlet pain. Another thing I did was change to the anti-inflammatory diet. So basically, there are foods that cause inflammation, and you're trying to eliminate those. And this was surprising to me when I started researching the anti-inflammatory diet. But seed oils, like canola oil, vegetable oil, corn oil, those cause inflammation. And so I have eliminated stuff like that. I already don't eat high fructose corn syrup, and like I don't drink Cokes or sodas or anything like that. So I already did all that. No more plastics. But trying that anti-inflammatory diet and see if that helps you reduce inflammation, thus reducing some of your pain. I do a low carb version just to keep my weight down, and I don't really believe in eating oats and grains. So I've been like that since I was 22 years old. So I just eliminate other inflammatory foods, seed oils being the biggest one. And speaking of eliminating things, one of the things that was really aggravating me, and this was really shocking to me because I've been drinking coffee since I was 17 years old, was caffeinated coffee was causing my symptoms to be magnified. Like my headaches, I would get them all daily. It would feel like I was shaking inside. I would feel nauseous. And then I switched to decaf, and then I only drink 1 to 2 cups a day instead of like the 3 or 4 caffeinated that I used to drink. Cutting the caffeine out has significantly reduced my headaches, and I no longer get the shakiness, and I no longer feel overly nauseous. So just cutting out caffeine has reduced my pain and the severity of my symptoms. And some other things that I did was reduce the amount of dairy that I take. I noticed that so I rarely drink milk. I usually put heavy cream in my coffee. But I noticed that if I had too much cream, I would get a stomach ache. And so I've really reduced the amount of cream. I don't drink milk or skim milk or anything like that. It was cream, but I use a lot of it. And I've reduced that. So try eliminating some things from your diet and try the anti-inflammatory diet and see if that helps you. Physical therapy. A lot of us who are diagnosed with thoracic outlet syndrome are sent to physical therapy because it's thought that we have bad posture or we have weak muscles. So in my case, I was injured by a chiropractor, and that just wasn't true. I was strong, I working out a lot, eating low carb, but physical therapy aggravated my symptoms. But if you can get a good therapist, they could help you in other ways. So one of my physical therapists did scraping on me at the end of my sessions, and I found that to be helpful. So scraping or gua sha, you get the scraping tool and you scrape, along your neck, chest, scapula. You can see if that offers some relief. Along with that, you could try acupuncture or dry needling. And I've tried acupuncture, and I found that it did not help me at all. I did it for about 3 months. And in my acupuncture sessions, she also did cupping. And that's where you take a glass cup and they put it like in areas of your back, and then they suck all the air out and it like pulls your skin up into the cup. I really don't know what it's supposed to do, but it didn't help at all. So about after 3 months, I gave up on acupuncture and cupping. I did physical therapy for between 8 and 9 months before I gave up. Switching pillows. I have a lot of different pillows. And if you watch my other video, I show you the pillow that I use. And so I have a lot of different pillows. And so I adjust the way I sleep. And obviously it hasn't cured me, but I can sleep more comfortably. Also, lots of stretching. I stretch every single day. I usually stretch when I'm laying down because my posture is better. I'm not confident in my upright posture, so I lay down when I do my postural exercise. You stretch your neck, stuff like that. And I do other exercises, and I also put a roller behind my head, to help with the curve in my neck. And again, none of those are curing me, but maybe they're helping. Stretching is pretty good for you anyway, so I'll continue to stretch. But there's something about, so I stretch my neck every day, just lengthening the muscles. They just feel so tight. So I'll put a warm compress on my neck, and for like 10 minutes, and then I'll stretch because it makes the muscles more pliable. And so I'll do that. And along with stretching, I went to postural restoration therapy. Look it up. I don't regret it. I actually think the therapist was really great. I learned all these things about everything that I'm doing wrong posturally and trying to fix it. So I was given a series of exercises. I learned that my head sits to the right. It's not in the middle of my body. So we have exercises that try to get my head recentered. And some people may have neurogenic thoracic outlet syndrome because of their posture. We live in a time where we're always looking down at our phones, and maybe we have a job that makes us look down, and then we lose the curve in our spine and our neck, and maybe that's causing some of the issues. So postural restoration, you'll probably learn, at the very least, you'll learn a lot about your posture and the way you carry yourself in the world, and you can correct it. Another thing I did is I went to a rehab place and did shock wave therapy. So this is a wand that uses acoustic waves, or like sound waves, to help break up scar tissue. And it's supposed to break down scar tissue, like stimulate tissue repair, reduce pain and inflammation. And this one's really questionable for me because afterwards, I thought that my pain reduced. So they wouldn't wand my neck. For some reason, I guess it's a sensitive area and there's lots of stuff in there. So they did it on my pec and my scapula, and it feels like you're being electrocuted. It's pretty painful, and it's a little bit expensive. And I did it for maybe like 3 months, and I decided that I didn't get enough benefits for the cost I was paying. You can also rent a shockwave machine um, per, I think, either weekly or monthly at your house, and you can have somebody do the wand on you. And I strongly considered it. But then I thought, my husband, he doesn't know what he's doing, and I don't want to make anything worse. So I did it at a rehab place instead of having my husband use the wand on me at home. But it's shockwave therapy, and you can give it a look up and see if that may be something you want to try. I also did Botox in the neck. He did it in the neck and the pec. And I got 100% relief for about 3 weeks before my pain came back horrendously. It was horrible. And maybe it was horrible the whole time, but because I was pain free, I didn't realize how horrible the pain was. So it was about $1,300, and $1,300 for 3 weeks isn't really a good deal. But I think I would try it again if all else fails. So just because it gave 100% relief, it's the one thing that did. And if you're looking at injections, I've also gotten trigger point injections. They're far cheaper than Botox and other injections you can get. I've had them done in multiple places. I try to get them done in the scapula, and I got pretty good relief from trigger point injections in my scapula. A lot of relief. And I did it multiple times, and it's pretty inexpensive. I also had, because I get occipital headaches, they did my, I guess, occipital area back here, and it increased my pain. So I will never let anyone give me a trigger point injection in the occipital area because it was torture until it wore off. But trigger point injections could help you, and they're relatively inexpensive. I also had stem cells injected into my scalenes, and the theory behind it is it repairs and regenerates cells. It facilitates healing. Stem cells are like blank cells, and they turn into the cells they need to be. And I had it done, and it did not work for me. It was about $900. But I'm on the fence about this because when I was injured, if I would have got the stem cells, I had stem cells done about 2 years after my injury. But if I would have done it right after my injury, maybe it would have helped me heal, and I wouldn't be in this situation. So maybe if you get it earlier on, it could help. But we won't know about me because I'm so far along. And there's also platelet-rich plasma. That's where they take your plasma and they inject it back into you, and it helps stimulate healing and nerve repair. I haven't done it. One of my doctors suggested it to me, or two of them mentioned. It's been mentioned by two doctors, and I went with stem cells. And from what I understand, platelet-rich plasma is maybe a couple $100 less, but you're still looking at a hefty price tag of like $600 or $700. Could it work? Maybe. It could be worth a try if you're willing to try it. Another thing I do, and this is one of the best things I've done, is medical massage. It's not a relaxing massage. It's a medical massage, and there's all different kinds. I see a person who specializes in connective tissue disorders, and she's really gentle, and she knows what thoracic outlet syndrome is, and she knows the areas to target, and she's very gentle. I've had a massage where they're like pulling at your SCM, and they're just jamming their fingers in you, and it was horrible. I almost didn't go back after that massage. And I asked if there's somebody who's more gentle, and I found two massage therapists who are amazing. And they give you a lot of feedback about what they feel, and like the tightness and the tension. And if they feel something weird, they tell you. So you get all this information from them. And if you have a good doctor, you could take it back to a doctor and say, they feel something weird in here, or I don't know, but that's where I got the most information was medical massage. Um, and so I'm kind of leading up to where I'm going. So after doing medical massage, I started doing soft tissue therapy, and he uses ART, active release technique. So, like the massage therapist, they're all feeling, and they tell you if they feel something weird or if your muscles are overly tight, and they give you a lot of feedback. But I noticed I started to feel better after art therapy, and he just puts, hits these pressure points, and it's like pressure and movement. I'm not I'm not cured, but before, my pain was at like a 7 or 8. I've even been to the hospital, and now my pain usually sits around a 3. Maybe I can get like a 2, and it hardly ever goes to an 8 ever again. Usually like a 6 or a 7. My pain has come down tremendously. And before, I could be in bed partially during the day. The pain and the headaches and all the stimuli, like noise, I couldn't take it. And now it doesn't bother me as much. I'm pretty high functioning. One of the things I also did was I went to a neuro optometrist, and I was having problems with my right eye. Actually, it was a little droopy, and I had an enlarged pupil. You can see that I don't have an enlarged pupil. Usually it'd be like almost like a blackout. And so I did 12 weeks of neuro eye therapy, and my pupil has come back to normal. And I no longer feel like my eyeball is popping out of my head. My eye still is a little bit droopy, but a neuro optometrist, if you have an eye problem due to your thoracic outlet syndrome, it happened after my injury, and I actually thought I was having a stroke because my eye was drooping down, and then my pupil was enlarged, and then I was treated like I was an idiot for seeing the doctor. But I don't know what happened with my eye. My neuro optometrist thinks that it was in part to my nervous system and overactive senses, because I was having like super hearing. My startle reflex was crazy. Like if you shut a door, I would jump. If somebody screamed, I would jump. All that's gone now after my therapy. And so after my medical massage, which I still do, and my soft tissue therapy, which I still do, I kind of caught on to the fact that I might have an adhesion. So it was one of my massage therapists. I told her that I hurt right up in here. And so she was feeling around, and she says, "You got something in there. It feels like a piece of steak fat, and it's not on the other side. It's not, I've had them root around in there. It's not there." I had my husband. He's like, "Yep," and he can find it. There's something right here. I started looking up adhesions, and my medical massage person found something here. And that's when I went to soft tissue therapy art. And he said, "Yeah, you have an adhesion there." And so he works on it when I go there. And an adhesion is, so let's put it from my perspective. I was injured by a chiropractor neck. Let's say my body is trying to repair itself, so it secretes this glue-like substance and to repair itself. So let's say that my nerves get trapped in that glue-like substance, which forms an adhesion. And now I have this lumpy thing here with the nerves encased in it. And now I have all this pain and strange symptoms, right? So after doing all these things, looking into all these things, now I'm looking into adhesions. So I am seeing an adhesion specialist in North Carolina in August. I spoke to him on a telehealth call, and I don't know if this is going to be what cures me or lessens my symptoms, but I'm cautiously optimistic about it. There's something here. And the adhesion specialist they used a technique called ARM, ARM, adhesion release method, where they try to break the adhesion off. So pray for me that this is it. I don't know. I hope it is. So there's all sorts of things you can try before surgery. Pain meds, muscle relaxers, heat ice, magnesium cream. Change up your lifestyle. I know you don't want to do it. You've been a certain person all your life, and now you have to change. I get it. Coffee, just to go cut the amount in half and go decaf. That was really hard for me. Wearing a fanny pack. I've always been anti-fanny pack since I was like in the 80s, and now I'm wearing a fanny pack, you know. So find out what aggravates your symptoms and change your lifestyle a little bit. Try the anti-inflammatory diet. Eliminate things that cause inflammation. Try physical therapy. Hopefully you get a good physical therapist that gives you insight. Acupuncture, scraping, switch out your pillows, stretch every day. I hope that you can fit in some sort of exercise. I go for about 2 walks a day and do various stretching. I'll do lower body as well, but try to, keep in shape and do that, because you got to stay healthy. Postural restoration therapy. You can see if you have one near you. Shockwave therapy. You can see if there is a rehabber somewhere in your city that has the wand and you can try it. Botox is super expensive. If you get the Botox and it gives you 100% relief, you're on to something. You know that the pain is in that area, and that gives you information. Trigger point injections, the same with that. If you're ready to move on to stem cells and platelet-rich plasma, those are things that are available to you. And soft tissue therapy, ART, look it up, active release technique, and medical massage. Those two were two major things for me that really helped. Adhesion specialist. I don't know about that yet because I haven't seen him yet, but I'm hopeful. And if life is still bad, there's always surgery, and you got to do what's best for you. Okay. So I hope my list of things that were things other than surgery might help you. And thanks you guys for watching. Bye.